Hi, Susan. How are you today?
Oh, I'm doing okay. How are you?
I'm doing fine. Glad to see you here. I know in your chart it says that you just got out of the hospital. Can you tell me a little about that?
Yeah, they put me in the hospital. My family put me in there. I'm kind of mad at them because they sent me to the hospital, but I'm not really sure why. I mean, I got kicked out of my apartment because me and my neighbors, we didn't really get along. They tried to come over, and my boyfriend, he didn't really like it. Or, well, I didn't think he would like it, so I was trying to scare him off by pulling knives on him and stuff. So.
Hmm. So you're still a little confused, it seems like, as to why you had to leave the apartment.
Yeah, I don't really know why I had to leave. I mean, the other people, they were the one that they were bothering me. I wasn't really trying to bother them. I just wanted them to leave me alone, and they wouldn't leave me alone, so I had to pull a knife on them.
And looking back at this situation, now that it's, a couple weeks ago, what do you think, if anything, you could have done differently?
Well, I mean, I guess I probably shouldn't have pulled a knife on them. They were just being neighborly. I mean, maybe I should have just talked to them. Maybe talk to my boyfriend about it. I don't know. He hasn't really been coming around much.
Okay. Well, still, that's really good insight for you to have. Just to look back at your behavior and think about what you could have done differently, because now you're in a situation where it looks like you're going to be looking for a new place to live, and those are going to be things that you want to consider whenever you find a new place.
Yeah.
So tell me a little bit more about your situation now. You're out of the hospital, you don't have a place to live. What kind of things are on your priority list right now?
Well, I definitely need to find somewhere to live because I've been staying at this hotel and it's expensive and I don't really like it. So I need to work on that.
Is that your number one concern at this point?
Well, I mean, I'd really like to get my boyfriend to come back around.
Yeah. Between those two things, which do you think is most important right now?
Um, I mean, I'd really like my boyfriend to come around.
Well, hopefully, as we work together, we can kind of take a look at your needs at this point in your life and try to prioritize, you know, what's most important. What do we really need to focus on from here on out? Tell me a little bit about what you do in your free time, who you hang out with, what kind of supports do you have in your life right now?
I'm not really talking to my family right now because I mean they're the ones that put me in the hospital and they just think I'm crazy. So, I mean I have some friends. I'm not really that close to them though. I mean, I wouldn't say they're good friends. Sometimes they use drugs and stuff like that, but I mean, I don't know.
Would you mind if I asked you a couple questions about your past? I've seen in your chart that you do have a pretty good history of long remissions where you've been stable and you've been able to be active in the community. Tell me what it was like then. What kind of people were in your life and what kind of relationships you had.
It was good. I was volunteering. I mean, I had good people in my life. I enjoyed working and volunteering, surrounding myself with good people. It made things a lot better because I could rely on them and trust them.
Were you on medication at that point in your life?
Yeah, I was. Yeah, medication. I think it helps me some.
Mm-hmm.
Makes me feel a little bit better about things. I think things more thoroughly when I'm on medication.
It's really impressive how well you did at that point in your life when you had, kind of had all those ducks in a row. And I'd really like to see you get back to that point. Um, if you had to pick one thing that was right then that you want to happen now, what would it be?
I would like to have somewhere nice to live.
Okay. Well, that's definitely something that we can work on, and I think as far as therapy is concerned, that's a priority right now because a lot of times it's extremely stressful on someone to not have a permanent place to live, and it can really impede treatment, especially when you have some issues with your mood and stuff like that. So, um, tell me what you think are the things that are keeping you from being housed right now. What are some issues that you're having?
Um, I mean, definitely my mood. I mean, I'm not very happy, and I guess you would say I'm not very stable right now. I'm up and down, so I'm having a hard time communicating how I feel and what I need in my life.
When you say your mood is unstable, what exactly do you mean by that? Are you having trouble communicating one-on-one with people? Are you getting frustrated with people? What's that look like?
I definitely get frustrated with people because I feel like they don't understand me or what I need or how I'm feeling. So, I mean, 1 minute, like, I feel happy, and the next minute I'm not. So, I think people realize it's hard.
Mm-hmm.
And my life's hard right now.
Yeah. So, what do you think that you need to do to get yourself to a point where it's easier to find an apartment?
I probably need to get on medication again just because when I'm on my medication, I feel like I accomplish a lot of things and things go more smoothly. So, I think that would probably help.
Absolutely. And do you have a plan for yourself now that you're out of the hospital? And do you have a plan for getting medication and taking it regularly?
Yeah, my first step was coming here to talk to you, so it could maybe help me because I'm not really sure where to go right now. But if once I get there, I would definitely like to stay on my meds so that I could stay happy and healthy.
I think that's a great plan, a very important piece of the puzzle right now. And another thing that is really important in recovery is having a support system. So tell me about your family. I know that you're mad at them now, but what does your guys' relationship look like when you're not mad at them?
It's usually pretty good. I mean, when I'm on my medication and I'm not putting in the hospital and stuff, we get along, we talk, hang out. So, and when it's good, it's good.
Why do you think they put you in the hospital?
Probably because I stopped taking my meds and I was acting a little crazy.
What about you acting crazy do you think alarmed them?
I mean, I guess it had to do with the fact that my boyfriend, I mean, he's married and doesn't really want to have anything to do with me, but I mean, I just wanted to prove to him that I really care for him, so that's why I was pulling knives on people. So I pretty bad. That probably didn't help my family situation. It's probably why they put me in the hospital.
Well, that's really good insight for you to have, and I think what I'm hearing from you is that deep down they really care about, you know, where you're at as far as your mood and all of that, and they had some genuine concern for you. So tell me, on a scale of 1 to 10, how important is it that you reconnect with your family?
Probably right now, like maybe a 6 or a 7.
Can you explain that a little bit?
Oh, I don't know. I'm still just kind of mad at him. I guess what you're saying is true. They did put me in the hospital for a reason, but it still kind of hurts my feelings. So maybe after a little time, it'll be better.
Do you think that there's anything that you can do to, at this point, to kind of mend those relationships? How do you see that unfolding over time?
I mean, I think they'll trust me more once I, continue with the counseling and get the medication and stuff like that. I think that'll be a very good first step. And then I think they'll make me feel a little better about things, and then I'll be able to talk to them, and they'll be able to talk to me. So,
That's great. I think that once you get reconnected, you might find that it's very possible for you to get back to where you were before. So, yeah. Tell me a little bit about other support systems that you have. You said you volunteered before.
Mm-hmm.
Do you have friends there, or
Yeah.
what's the deal there?
I would say they're my friends, but yeah, I would say they're my friends. I mean, they're good people, and like I said, I can trust them and stuff. And I feel like for the most part, they trusted me until I made a mistake. But if they're friends, I think they'll forgive me. So.
Do you think that they play a role in your recovery?
Yeah, I mean, they've been trying to reach out to me ever since it happened. So I think they do play a role. I think they're trying to help me get on the right path again.
That's good. I think those are all things that are important to keep in mind. One, I've noticed that you do have a lot of positive supports in your life, and you have a good history. This is your first eviction, correct?
Mm-hmm.
So obviously that's a roadblock, but you have a lot of strengths in your past, and with people around you, that you can have some hope for the future as far as finding a new place and kind of starting a new life for yourself. Tell me, I know that you're under a lot of stress right now, and that definitely affects your mood, but tell me at this point, how hopeful are you that things will get back to the way they were before?
I'm pretty hopeful. I think it will be okay in time.
That's good. Can you tell me, on a scale of 1 to 10, how you feel about moving forward at this point?
Oh, I'd say probably
Okay, that's good. You seem really motivated, and that's really important. I would hope that in therapy sessions from here on out, we just move towards, helping you feel as empowered and successful, I guess, as you did in the past. So just keep continuing to work on housing, and just kind of explore what your relationships mean with people that care about you, and that's something that will kind of keep evolving over time. So, thanks. I'll see you next time.
See you later. Oh wait, I can't go there. I'm trying to get on the video.
Okay. So in that session, I chose to use the psychosocial model mainly because of her housing situation and the recent conflict with her family, just to assess her strengths and her needs at this point. Obviously the housing issue is, first and foremost, the biggest thing that is a concern as far as therapy is concerned. Also, I wanted to use motivational interviewing techniques to kind of bring out, have her reflect on her past and what worked then and apply it to, her new situation. I definitely felt like that was important to motivate her and kind of help her feel like she had enough strength and feel empowered to keep moving forward with her recovery. I think the biggest consideration for treatment right now is the housing issue and getting stabilized back on meds. And then ethical concerns about both of these models. The biggest one is just the client's right to self-determination and making sure not to force my values as a therapist on the client and allowing her to choose her own path for recovery and allowing her to choose things that were important to her to focus on as she moves forward. So I think that's it.